Welcome to this explainer. Today we're jumping right into a topic that honestly brings up a ton of questions and kind of throws a wrench of uncertainty at so many Muslim women. We're talking about istihada. So if you're tracking your cycle and just really want worship clarity without all that sudden panic, well, you are definitely in the right place. Let's get started.
Section 1. Unexpected bleeding. A new word. Seeing unexpected bleeding can be a really deeply emotional moment, you know?
You saw bleeding outside what feels like your normal period. Now you are wondering, what does istihada mean? Look, it is completely normal to feel a sudden spike in anxiety right here. Maybe prayer time is creeping up and you literally just want to know what to do. The absolute best place to start, it's simply by learning the vocabulary.
Moving to Section 2, Istihada in plain language. You see, istihada is a term a lot of Muslim women hear when their cycle decides to behave unpredictably.
Okay, let's dive into this definition together. We want to approach this really gently. Istihada is often discussed as non-menstrual or irregular bleeding in Islamic worship contexts. Basically, it's a category used to describe bleeding that falls outside the normal parameters of a menstrual period. But, and this is absolutely crucial, understanding the word itself is just the very first step.
Because here's the thing. Istihada is a term that helps name the question, but it does not automatically answer every personal case. Learning the word is super helpful, for sure, but it absolutely doesn't hand you an instant, ready-made rolling for what you're experiencing in your body right now.
Section 3, vocabulary is not a ruling. Knowing the vocabulary is not the exact same thing as getting a personal ruling. To put it simply, a definition is not the same as a ruling for your exact timeline. Even if you strongly suspect what you're seeing is istihada, just knowing the word doesn't give you a magical shortcut around getting qualified guidance. Your own personal timeline matters immensely here.
Section 4, Haid versus Istihada basics. Now, Haid and Istihada are two completely different terms used in Islamic worship.
And this brilliantly illustrates the distinction. On one hand, we have Haid, which refers to menstruation. On the other hand, there's Istihada, which refers to non-menstrual or irregular bleeding. We contrast these terms to help build up your vocabulary, but we've got to be really careful here not to issue a fatwa or give you any false certainty about your specific body based purely on a textbook definition.
Right, because Haid and Istihada are different terms, but your exact case still needs details. Real life just isn't as simple as reading a definition off a screen. Actually, real life requires the actual specifics of what you personally observed. Section 5. Why users get stuck. This anxiety loop usually starts when we try to figure everything out all at once. The panic often begins when you try to answer prayer, fasting, wudu, or ghusl questions from incomplete memory. You know the feeling, right? You might be standing there, totally stressed, wondering if you need to perform ghusl or if your wudu is broken, all based on some vague recollection of what happened earlier today. Do not jump from fear to a conclusion. Let's start with what actually happened.
Section 6, what to track for istihada questions, because having useful details completely changes the quality of the question you can ask. Here's a handy checklist for you. Useful details include timing, duration, flow, color, continuation, and pattern. Did the bleeding just appear once and stop? Is it continuous? What color was it? Does this happen every single month or is it totally new? These are the exact details scholars and doctors actually need from you. So remember, track what happened before trying to solve what it means. Observation must always come before interpretation. Write it down, preserve the facts, and just take a step back. Section 7. Irregular cycles need timelines. Whether it's irregular bleeding, PCOS, or prolonged bleeding, it all needs documentation.
Let's look at how this builds. Tracking an irregular bleeding pattern requires a clear timeline, not memory-based guessing. When your cycle throws you a curveball, trying to remember what happened 3 days ago is almost impossible. But when you have a clear visual map of what actually occurred over several days, that heavy confusion really begins to lift.
Section 8. How Noor Tracker helps. Noor Tracker is designed to help you organize your observations safely and calmly. Now, it is absolutely vital to remember this boundary. Noor Tracker does not issue fatwas or diagnose medical conditions. The app is there to preserve your timeline and build a guidance summary. It organizes all that messy context so you don't have to panic, but it does not claim to automatically know your personal religious ruling or your medical status. As we like to say, Noor Tracker helps organize the details before you ask for qualified guidance.
It acts as a super helpful organizer. That way, by the time you actually speak to someone who can help, you have a clear, objective record of exactly what your body did.
Section 9, scholar or clinician. Different types of uncertainty require different types of experts. Now, what's really interesting is how we break down exactly who to ask. On one side, we have a scholar. You ask a scholar for worship clarity when you're dealing with repeated patterns or when you need to apply a specific school of thought. On the other side, we have a clinician. You'd seek out a healthcare professional if you're experiencing severe pain, highly unusual bleeding, or medical concerns like PCOS. And hey, remember, sometimes both a scholar and a clinician matter for the exact same issue. The big takeaway here is that better notes can help you ask a better scholar or clinician question. When you hand them a nice, clear timeline instead of a bundle of anxious guesses, they can give you much better, much more accurate help. Section 10. Learn, track, ask. Let's recap this whole core philosophy in a few calm steps.
Start with what you observed. Keep the timeline clear. The key is to just break the whole process down into manageable, calm steps. Learn the word, track the timeline, ask with clarity. So, will you continue to let anxiety dictate your cycles, or are you ready to stop guessing and start observing? Regain your peace of mind and learn more at noortracker.com.